Hi, my name is Gilda, and I will be going over the sport I've chosen, which is soccer for middle school boys. I'm going to go over some of the factors that may cause the injury, three common injuries actually, the anatomy of it, the mechanism, some of the treatments, and how to determine if they do have this injury, along with some preventative and rehabilitation exercises. So what factors can attribute to this injury? And it could be environmental, for instance, because soccer is an outside sport, so rain can attribute to this. Wet surfaces, muddy fields, uneven surfaces, poor conditioning, fatigue. And what I mean by that is because when it rains, it can cause mud. The shoes can get stuck, and it can cause an ankle sprain. And this is one of the first ones, one of the main ones that happens. And so, what are ankle sprains? They're ankle sprains. It's pretty much an overstretch of the ankle. When one is walking, maybe there's a pothole, one puts the ankle, and then bam, feels like your ankle is going out. So in this case, what's happening is that we're overstretching the ankle, the ligaments of the ankle. But in this case, the most specific one, which is the weakest one as well, is the anterior talofibular ligament. So this is originally how a normal ligament would look like. Grade 1, it has some stretching, small tears. Grade 2, larger but incomplete tears. And grade 3, a complete tear. So some of the mechanisms of injury is that it just happens. It doesn't necessarily mean that these athletes can have a type of contact. It can just happen when maybe there's a hole in the field and they get their foot stuck, and then they just twist their ankle. So it would be an unexpected inversion or eversion movement of the lower extremity. Like I mentioned, it causes injury of the anterior talofibular ligament. And this can also happen because there's a lot of jumping, a lot of running. It's just explosive sudden movements that can occur. Like I mentioned, it's sudden inversion of the ankle. It causes the ligaments to stretch. Let's see. And some of the exams that we can do to determine if they do have happen to have an ankle sprain, which will be the talar tilt test, which there's excessive motion of the talus, which would indicate an injury to the calcaneofibular and possibly the anterior and posterior talofibular ligaments. So it's pretty much the ankle ligaments that will help us determine with this test right over here, the talar test, and the anterior drawer test, which helps when the foot is being slides forward, making a clunking sound. So this exam will also help us determine if we have a ankle sprain. More specific, the anterior talofibular ligament tear. Other ways to determine this is by doing an MRI, because x-rays will not help with this. X-rays are only for mainly the bone, that it'll help us visualize, and the MRIs are a little bit more extensive. In this case, they'll be able to tell us if there's anything else for if the injury involved the ligament. Some of the treatments with RICE, which is rest, ice, compress, and elevate. We immobilize it. This will be an example of a closed basket weaving. The athlete would be non-weight bearing, which means we will make sure that they're not applying pressure on that ankle. Isometric exercises, which pretty much is just in one motion, versus we're not flexing or extending the ankle, and then we work eventually on range of motion. These are some of the exercises that will help us. A prehab exercises, which will focus on the calf raises and gastrocnemius towel stretches. It will help us to strengthen the surrounding, some of the surrounding, or at least, it will help us strengthen the gastrocnemius and the soleus, which for the ankle. And these are some of the rehab exercises, which will be post-injury. And there's a video attached later for that. The next exercise is the patellar tendinosis. It is also known as jumper's knee, which there is pain in at the knee. So this is what the knee is. It consists of the femur, the tibia, and the patella. The patella is being connected by the quadriceps tendon tendon. And then on the inferior aspect, we have the patellar tendon. And this gets inflamed, and that's what can cause some of that pain. It's involved with the sport with the repetitive and sudden movements of the knee. Like I mentioned, soccer is very um, it's involved. It involves a lot of sudden movements because the ball can be in one side of the field and then all of a sudden it's on the next side. Or you have to the athletes have to be very aware of their surroundings. They may have another athlete come towards them because they have the ball. So we just want to make sure that they they are aware that there could be some pain involved to the knee. So again, it's on the anterior aspect. Let me go back 2 slides. This is the anterior aspect. There will be pain present if there is a patellar tendinosis. One of the exams to confirm this is by applying pressure directly to it, and it will help us determine if they do have this irritated tendon. Let's see what else. I'm sorry. Other exams in case other than this will be an MRI, which will help us determine if there's worsening or there's a rupture. Some of the treatment would be massaging over the area where it's irritated, in this case in the inferior or superior aspect of the patella, ice or heat, or this brace right here, and they can even take oral anti-inflammatories if they need it for inflammation. These are some of the rehab exercises, bridges, which will help with hamstrings and quadriceps, wall slides, and then the rehab exercises would be single leg squats and lying leg curls. Shin splints, which is pain located in the anterior aspect of the shin, which is right in this area, and that is it has a lot of conditions under this name in particular. They have stress fractures, muscle strains, and a chronic anterior compartment syndrome. So because we do have muscles and they can be overused, they can have little micro tears. See, and there, because it's a muscle as well, there could be some strains in there. So the mechanism of injury, it can be attributed to the training volume and intensity, not necessarily because they come in contact with another athlete. And because of the sudden movements, and they stop and go from, like I mentioned earlier, the ball can be on one side of the field and then it can be in the next side of the field. And we just want to make sure that you are aware that this is another of the possible common injuries that can happen, running on hard surfaces, or maybe wearing the wrong shoes. Maybe they have flat shoes, and we want to make sure that they don't have that. Or maybe their legs are, not their legs, their feet are malaligned. They have varus, so it's coming out a little bit. This is one of the exams that will help us determine if they do have shin splints, which is pain located in the medial anterior aspect of the tibia, which is in the inside, and the tibia where the bone is, and medial is inside, and anterior is in the front of. So there can be pain in that area. If they do X-rays, in this case, stress fractures can be revealed in an X-rays. Physical assessments would be palpating the leg to determine if they have the patellar tendinosis. Treatments would be ice, putting it in a towel, wrapping it in a towel and applying it to the area, putting it on and off in order for them to feel a little bit of that alleviating pain. They're stretching the muscles around the shin and increasing the strength of the hip rotation, hip abductions. Exercises would be the vertical jump, which will help with flexibility, and straight leg raising. And then there's the rehab exercises, which will be squats and calf raises, which will also help post-injury. And I'd like to thank you, and I hope you have learned a little bit about the 3 common injuries that occur with this type of With the soccer. I'm sorry. I do apologize. Thank you.